Hello guys, how are you? Hope you are doing fine. Today we are here presenting you with something very big. That is the last minute pharma, your exam antidote. So you might be thinking, why are we starting this channel? This channel we are starting because we are your friends who are going to help you in the last minute exam, a last hour before the exam. So come on, let us join with us and let's start to reveal about the pharma world. We are going to take majority of the subjects which are going to be there important for your examinations, especially for the healthcare system. There will be pharmacy, even nursing students can watch us, and even the MBBS students can watch us for this particular subjects. Today, the first channel, the first time which we are going to start, the first video which we are going to make, that is about subject pharmacology. One of the very difficult subject, right? So yeah, we are here to simplify it for you, and you can ace your exam with this subject. So are you guys ready? Let's start. So now, in this particular video, we are going to discuss about the pharmacology, the general introduction of pharmacology. This will be a very short video. We'll be covering just the introduction part. Okay. So first about, and see, before starting this particular topic, right, you have to understand certain things, especially being a PharmD, B.Pharm or MBBS, whatever is coming in healthcare system, like it will be nursing also. Main thing you have to understand over here is that this pharmacology plays a very important role. Because whenever you are treating a patient, you are going to give a drug. And if a person doesn't know what the drug is going to do to the body and what the body is going to do to the drug, then there is no use, what you are studying. Okay? So make sure that in this particular thing, you make your pharmacology strong. And we will be here to help you. So let's start. In this particular video, we will be discussing about the definition of pharmacology, what is actually pharmacology in technical terms. Okay, then we will be studying about the scope of pharmacology. Like in the field of pharmacology, how can we explore pharmacology? Okay, in the scope, indirectly we are going to understand how we can explore pharmacology. Then after studying the scope and definition, we are going to come to the basic thing, that is the drug. What is a drug? Okay, see, majority of the people already know what is a drug, okay? But the problem is they don't understand the concept behind it. Okay, so first thing you have to understand what is a drug. Then you have to understand what is the sources of the drug. So for example, from where do we obtain the drug? Okay, there are various sources we can find out. And last but not the least for this particular video, that's the route of administration, which is a very important for your examination. Okay, and see, in this video, we'll be also providing you the last minute questions, okay, so which have been coming up in the examinations, so that can help you. Especially, I will be focusing on RGHS paper. As nothing but Rajiv Gandhi University's Health Sciences, I will be focusing on the PharmD and B.Pharm papers, but other papers also will try to cover it up in the upcoming sessions. Okay, so let's start out. First thing which we are going to discuss, that's nothing but the definition of your pharmacology. So what is a pharmacology? What do you mean by pharmacology? Pharmacology is nothing but, it's a branch of science. Okay, pharmacology is nothing but branch of science which is going to deal with the drugs. It's a branch of the science which is going to deal with the drugs. Now what about drug? What are the things which you are going to consider? How the drug, what are the drug effects? What are the drug effects? And how was this drug helping us? How was this drug helping us to relieve any disease? How is this drug helping us to relieve diseases? Then we can understand that how this drug is also used as a diagnostic. How does this drug help us in the diagnosis? Like for example, various drugs are used in the form of diagnosis. Like for example, if you want to know particular diagnosis, we use certain drugs, which will be there, we will be discussing in the further topic. Okay. So these are the basic definition. This is the basic definition of pharmacology. It's nothing but the study of the drug, or study of the branch of science that deals with the study of drug. Study of drug, its effects which is there, then its action which is there, its uses, and its how the body how body interacts with the drug. So I hope till here is clear. Definition, obviously in examination is not important, but being a pharmacy graduate or being a pharmacy learner, you're supposed to know what is this pharmacology meaning. Anybody can come and ask you what is pharmacology. So you should not be blank in front of lecturers. So we are here to help you out. Pharmacology is nothing but it's a branch of science that deals with the drug effects on the body and how does it help to relieve the symptoms and its diagnosis. Okay, I hope this is clear to you. Now, after this, we will study about the scope. What is the scope of pharmacology? Let's explore. Scope is nothing but exploring pharmacology. Scope is nothing but exploring your pharmacology. Okay, so when we explore your pharmacology, what are the things we have to understand? Exploring pharmacology means what all comes in pharmacology. First thing we have to understand is your pharmacokinetics. About your pharmacokinetics. So what is pharmacokinetics? Almost similar term is there, that is called as your pharmacodynamics. That is your pharmacodynamics. These two terms are very important, and throughout the session you will be hearing it many times from the teachers also, and it is a very important topic. Okay, so if we talk about what is your pharmacokinetics, okay, so pharmacokinetics means that what the body is going to do to the drugs. In pharmacokinetics, we are going to understand what the body is going to, when you take a drug, when taking a drug inside your body, what will the body react? What will body do to the drug? What will body do to the drug? Now, for example, you are taking, when you are taking a particular drug, what happens initially? See, this topic which is there now, we will be discussing in detail. Okay, this is a very important topic for the examination point of view also, and for your understanding purpose also. So, we are understanding in detail, but just to cover up the scopes, I am just telling you the very just of it. So there is a huge, iceberg inside. So I'm just telling you the peripheral mountain. Okay, so iceberg is still there. So pharmacokinetics is nothing but it's how the body is going to react to the drugs. In this, it will be like when taking a drug, it's going to be absorbed in the body, right? Afterwards, it's going to get distributed, then it will get metabolized, and then it will get excreted. Right? We'll be discussing that in detail in the further classes. Then next is what is pharmacodynamics? A very important term. What is pharmacodynamics? Pharmacodynamics means what is the drug? What is the drug going to do? What is the drug going to do to the body? For example, okay, when you take drugs, obviously, right? Don't think about other drugs or not. I'm focusing on major pharmaceutical drug which I'm concerned about. Okay, so what do you mean when you what is the drug? When you take a drug, what is going to happen? Obviously, taking a drug for a particular action. So to show the action, it has various mechanisms are there. Okay, in this pharmacodynamics, we'll be studying about all the mechanisms. How the drug, when you take a drug, which receptor is going to act, or how is this drug going to affect the normal physiological changes. Okay, how is this drug going to affect the normal physiology and get your desired physiology? For example, when a disease is there, okay, try to understand simple terms. When you are having a particular disease, your normal body physiology which is there, that has been altered. Okay, when you are having a disease, your normal physiology has been altered. So why do you take drugs? To correct that physiology. So for correcting that normal physiology, what we study? We study about the pharmacodynamics, because we have to know that how it is going to get corrected. Various mechanisms are there. Again, I am telling you, this is just the mountain in the ocean. We still have a big iceberg which is left, which we will be discussing in the upcoming classes. Okay, the next one which you have to understand. Okay, next one which you have to understand over here. That is your pharmacogenomics. So what is your pharmacogenomics? Pharmacogenomics are nothing but you are going to alter the genetics. Okay, pharmacogenomics which is there is nothing but you are trying to understand the genetic influence, okay, on the drug. You are going to understand the genetic influence on the drug. That will come under your pharmacogenomics. Okay, the next one which is there, you have to understand about one of the scope which is there of pharmacology is toxicology. So what is toxicology? Toxicology is nothing but whenever you are taking a drug, okay, whenever you are taking a drug, it's causing effect of drugs and poisons. Okay, toxic. Okay, toxic means when you take a particular drug in higher concentration, it's obviously going to be toxic, right? To study of that toxicity, of a drug or a particular poison in the body, that comes under your branch. This is your toxicology. So these are nothing but scope of pharmacologists. These are nothing but your scope of pharmacology. Now next, very important, and I should have taken this first anyways, I have missed it. So very important this is, that is your important subject which you are also learning, that is your therapeutics. One of the important scope of your pharmacology is nothing but your therapeutics. Because obviously when you are giving a therapy to a patient, therapy to a patient, this pharmacology which is there, it plays a very major role. Okay, so next we'll be discussing many things are there. This was just the scope of pharmacology and definition. And in this particular video, next we'll be going to the next topic, that is nothing but what is a drug. Next we'll be going on to what is a drug. Okay. So now we have finished already definition and scope, okay? So let's go to a very important term, that what is a drug, okay? So drug which is there, it is nothing but a chemical substance. It is a chemical substance, okay? Drug is a chemical substance which is going to have effects in the body, okay? That's going to have effects on the body. So any substance which is there, any chemical substance which is there, which is going to help in providing us the effect in the body, that's called as the chemical, or that's called as a drug. Okay. So it's nothing but a chemical substance which is going to affect the biological activity. It's a chemical substance that is going to affect the biological activity on the body. Okay, I mean obviously it's acting on the body. That's why I'm telling that it is going to affect on the biological activity. That means it's going to affect your body. Okay, so any substance which is going to, whenever they are introducing, okay, whenever this substance is introduced, any chemical substance which has been introduced inside the body, that is going to show an biological effect. Are you understanding? A drug, when you are going to take it inside your body, that is a chemical substance. Okay, when you are taking it inside our body, it's going to show us the effect. Okay, biological effect. That is called as a drug. Okay, now from where do we get this drug? We all know, okay, we are talking about drugs and all, but from where do we get? What are the sources of drug? So this is a very important question for the PharmD, B.Pharm examination, RGS examination, which will usually ask you for 2 markers. Okay, like what are the sources of drugs, and everybody should know them. Okay, so one of the sources which I am going to write over here, that is your natural sources. That is your natural sources. You are having a natural source, like for example, if you are getting it from the minerals, you are getting it from the microorganisms. So these will come under only naturally. Naturally, you are going to synthesize this. Okay. The next one which is there, that you are going to prepare. See, obviously, very opposite, right? Natural, unnatural. That means synthetic. You are going to derive it. You are going to get that particular drug from the factories or from the laboratories. Okay. This will come under the synthetic category. This is your synthetic sources. These are your synthetic sources. Now, last but not the least, you are going to have the biological sources. You are going to have the biological sources. You are going to have the biological sources. So these are the major 3 sources which you are going to have. One is the natural source, synthetic source, and then your biological source. Okay. So now, in natural source which is there, we study mainly about the plants. Then you have to understand about your animals. Then you have to understand about the microorganisms, and then will come your minerals. So all these are natural sources. Plants, animals, microorganisms, and then your minerals. So if we talk about your plants, mainly very important and very famous drug which you are having from plants, that is your morphine. It's a come under category of opioid analgesics. It's nothing but a painkiller, a very strong painkiller. Okay, that's like just like an aspirin is like how it's going to have painkilling activity, right? Or you can say so similarly, in the plant category, you are having the opioid derivative of a painkiller, opioid derivative. That's nothing but your morphine. Okay, it's an opioid derived, it's an opioid analgesic. It comes under the category of opioid analgesic. That we'll be discussing. Okay, this is just I'm giving you an intro. We'll learn in detail in the upcoming classes. Then one more source which is there, that is your quinine. From where are you getting this quinine? Your cinchona. You might have studied in your pharmacy classes. Cinchona is going to give quinine and quinidine. These compounds which are there, they are used for the anti-malarial effect. Okay, these drugs which are there, they are used as an anti-malarial effect. Then next we are going to have from the animal sources. From the animal sources, we are mainly going to get from the pancreas of the pigs. Right? From the pancreas of the pigs, which were there, pigs you say, ox you say, bull you say. From this we can derive your insulin hormone. But yeah, one more thing you have to understand that, see, the one which we are getting, see, there are different terms are there. We use procaine and all these things, like procaine, insulin, all these things, which were derived from animals, okay? But in this, we don't usually use this. This is a very, it's not an updated one. Okay, we don't use this nowadays. The books now it's written that from animals we get insulin. But now we have better technologies, through biotechnology, through genetics which is there. okay, through biotechnology or RDNA technology which is being currently we are using. Through that also we can derive your synthetic insulins, okay, because the main problem, we are getting it from animals, right? This insulin which we are getting from animals, so this is very susceptible for the sensitivity. It will cause hypersensitivity in the patients whom you are going to get. So this is not much updated, but yeah, you can say from the animals we are going to get your insulin which is there. Now one more very important one which is there, that is your cod liver oil. One more source you can write, that is here cod liver oil. So cod liver oil, what is cod? Cod is a type of fish. Okay, it's like a fish oil. So why do we use this cod liver oil which is there? So one of the very important thing you can say, it is rich in omega-3. So again supplement it comes. And again it is used as a cathartic also. Okay, but it's used using as a cathartic. So various functions are there for this cod liver oil also. Okay, is it clear? Next, if we are there, we are going to focus on the microorganisms. So we are going to talk about the microorganisms. So from the microorganisms, what are we deriving? What are the different drugs we are deriving? Okay. So in this microorganisms, the major thing which is there, that is here, very famous, the Alexander Fleming gave you from the fungus he derived antibiotics, right? So which antibiotic is that? I want you guys to comment in the comment section, okay? I'll be looking for your comments. I want to know which is that antibiotic which they are going to give, like which has been discovered by your Alexander Fleming. Okay, I want to know that. Fine. So now a microorganism which is there mainly used for the antibiotic formation. So there are various antibiotics are there. And one of the antibiotic which I'm asking you to write down in the comment section, that is the one which is which is discovered by Alexander Fleming just by mistake. Just like how by mistake you go and bunk classes, right? Similarly by mistake this guy which is Alexander Fleming, he got an antibiotic. So please comment down in the comment section which is that, and let's see how many of you get this answer is correct. Okay, fine. And I'll be taking the answers. Don't worry, I'll be taking the answers in my next video. Fine. So next is your minerals. Okay, minerals means whatever you get from the earth's crust. Okay, whatever the minerals are there, right? In your 10th grade now you will have studied about minerals, metallurgy, ore, in your chemistry, that's old history work, okay? So in this minerals, what are we going to study? Minerals mainly like your magnesium sulfate. Mainly your magnesium sulfate is there. Many are there, I'm just giving you certain examples. See, again I'm telling you, this is your last minute friend. Okay, I am not going to teach everything. I am just going to teach you what is needed for you to pass the exam or get a good marks in the exam. So focus on that. Please, again I tell you, don't thoroughly depend on my video. You have to hard work. If you don't hard work, you won't be getting it. Okay, you have to work hard. If you're only watching my video in 2x, you won't have any effect. So better, you have to practice after the classes. Fine. So minerals which is there, you have magnesium sulfate, that is your cathartic. That is going to act like your cathartic. The next one which is there, which is there, you can write about your iron. That is Fe. So what is Fe? Fe is nothing but hemoglobin main component, right? So it's going to help us, it's a supplement whenever there's an anemic patient, right? So when the hemoglobin synthesis is less or when the hemoglobin count is less, so you give this supplement which is there, that is your iron. Okay, I hope it's clear till now. We have discussed about natural sources. In natural sources you are having plants, animals, microorganisms and minerals. In plants you are having your morphine, quinine which is there coming from cinchona. Then you are going to have animals. From animals we are deriving your insulin. I told you it's not an updated one. We have other animals also, other ways of getting insulin. Then microorganisms, we are going to get antibiotics. Don't forget the question. And then in the minerals format which is there, we have told about the magnesium sulfate, cathartic, which is used as a cathartic, and iron which is there is nothing but the supplement. We can use this as a supplemental form. Okay. So next one which you are going to study. Next one which is there, that is the synthetic sources. So what do you mean by synthetic sources? Synthetic sources means those drugs which are going to be made in the labs. Those drugs which are there, which we are going to synthetically make. Okay, by chemical reactions we are going to make it. Okay. So in the laboratory preparation, what is going to come? Mainly your aspirin. Which is there. Okay, mainly your aspirin which is there. I'll come and tell you. That is going to come under laboratory synthesis. Okay. Then you are going to have your paracetamol. You all know, right? What is paracetamol? Very common tablet which is there. Aspirin and paracetamol, these are certain examples. Okay, these are certain examples of synthetically derived. Synthetic sources of the drugs. Okay, I hope it's clear here. Now next is going to be biological drugs or biological sources. What do you mean biological sources? Okay, see I am telling you, don't get confused between natural and biological. Okay, here biological sources means those drugs which we are going to make with the help of biotechnology. please try to understand those drugs which we are going to make, okay, which we are going to make or we are going to get it by using your biotechnology. Now what will come under this? Mainly your vaccines. Mainly your vaccines are going to come under this. Mainly your vaccines are going to come. So vaccines are what? They are nothing but you're going to take a weekend. You're going to take a weekend virus inside your body, and then your body will be creating your immune response to fight against that particular virus, right? That's nothing but vaccine. Again, we'll be discussing in detail, okay, what is a vaccine, what different types of vaccines in this particular chapter also. Okay, so but simple way you can understand the vaccine is nothing but it's a weakened virus, okay, which is a weakened virus which has been entered or which you are going to inject inside your body, and your body is going to prepare the immune system to fight against that particular antigen, you cannot say, or particular virus. So in future, if that particular virus attacks you, okay, if that virus which is going to, the particular virus is going to attack you, these antibodies will be prepared to fight against that particular virus, okay. So I hope that part is clear. That is your vaccines which is going to be there. The next one which is there, that is your monoclonal antibodies. Okay, I just don't have space, I just write it down here, which is there. That is your monoclonal antibodies. So again, this also will be slightly difficult for you to understand the start. What is this monoclonal antibodies and all? Don't worry, we'll be discussing in detail. So for now, I'll just tell you, it's just like, antibodies in the sense, just now I told you about antigen antibodies, right? So see, whenever, why do you get if you talk about any infection or any, why do we get any particular disease? Whenever a foreign person or a foreign antigen, okay, a foreign substance which is entering inside a body, that foreign substance we call it as an antigen. So whenever this antigen is entering inside our body, okay, if your immune system is not able to synthesize the antibodies to fight against this antigen, so just take your antigen is nothing but a thief, okay, which is going to come inside your body to steal all your nutrients, okay. But if your antibodies as the policeman, they are not able to catch the thief, now what will this thief do? Thief is going to steal all the nutrients which is there from the body, and that's why you won't get the nutrient. And if you won't get the nutrient, obviously you will not feel well, right? So similarly, in this case, what are we doing? Biotechnologically, prepared, we are taking the monoclonal antibodies. We are enhancing the arming. We are going to enhance the arming so that even if the thief comes inside the body, then we will be able to. The police is strong enough by this addition of monoclonal antibody which is going to attack against that particular antigen. I hope that is clear. So what we discussed, drug is of three sources: natural sources, synthetic sources, biological sources. In natural sources, you are having plants, animals, microorganisms, and your minerals, and different examples we have studied. Then biological sources. The biological sources is also important, which is derived free. Again, I am telling you, you might get confused between natural and biological because bio, life, again you tell natural. No, it's not like that. Natural means plants, animals, microorganisms, and minerals. Biological means those sources those drugs which you are going to obtain from the biotechnology, with the help of biotechnology. Example is your vaccine, and you are having your monoclonal antibody. Now we are going to discuss about the route of administration, and this is a very important concept for your examination. 100% even in B.Pharm examination, from the examination, this is very, very important. That is routes of administration. Like for example, okay, you got to know what is a drug. What is a pharmacology? That's nothing but it's a branch of science that's going to give you the drug. Then in the definition you had drug. Now you know what is a drug, right? It's a chemical substance which is going to affect the biological physiology of the body, right? But now you should be understanding how do we take this drug. There are various ways you can take this drug, and every way is going to have its own advantages and disadvantages. So let's go and looking back, what are different advantages, disadvantages, and what are different routes which are there for this particular administration of the routes of administration of a particular drug. So okay, now a very important topic which we are going to understand, that is the route of administration. So this topic which is there is very important for your examination point of view also. So this is a pretty much confusing topic, okay? Like you will in various books different this thing will be there. So I have referred the standard guidelines, okay? About the standard guidelines I have given this classification. But then in different books, if we talk about KD Tripathi, something different is there. If you go for other guidelines, I think different books, different classification is there, okay? So mainly for the exam point of view, if I talk about, you have to mainly focus what are the blue boxes are there, right? Oral, sublingual injections which are there, okay? That also the specific injections are there. The intranasal is what you have to mainly focus on for the exam point of view. Anyways, I will give you an overview. What are the different routes of administration. For example, you got to know, right? What is a drug? So the drug has to enter the body. Okay, it is just like, for example, you talk about especially I'm from Bangalore, okay, so I'll tell you about the Majestic Metro. It's very confusing, right? You don't know, like you can enter the railway station in different ways. Right? Either you can go from the main gate, or you can go from the metro way, or you can go from the bus stand. So different ways are there. Similarly, even the drug which is there, it can enter inside our body by different routes of administration. Different routes are there. Okay, and every route is going to have its own advantages and its own disadvantages. Okay, let's try to understand that one by one. Okay, so this is the overall classification. We are mainly classifying route of administration into two types. One is your systemic, other one is your local. Okay, so what do you mean by systemic? That means those drugs which are going to enter inside the blood vessels. Okay, those drugs, whenever you take this drug particle, the final approach or the final thing is going to enter inside the blood vessel. And if I talk about local administration or local route of administration, what does it mean? You are mainly applying it. You are mainly applying it in the skin. Okay, and then later it will not enter the blood vessel. Okay, these drugs which are there, they will not be entering inside the blood vessel, and they are mainly responsible for giving the local effects. They are mainly responsible for giving the local effects. But whereas systemic route of administration, these are mainly there for the systemic effect. Okay, I hope it's clearly here. Now, in systemic effect which is there, we are classifying it into mainly two types. One is your enteral route, other one is your parenteral route. Okay, so what is the main difference between enteral route and parenteral route? See, both the things, very similar thing is that at the final test to enter inside the blood vessel. In both the routes of the administration, in enteral and parenteral, systemic means it is going to enter inside the blood vessel, right? So when I am telling you it is going to enter inside the blood vessel, again different routes are there. For example, this is your blood vessel. This is your blood vessel. So those drugs which are directly entering inside the blood vessel, okay, those drugs which are going to that will come into the parenteral route. These drugs which are the parenteral route. If I talk about the parenteral route, these drugs which are there, they are going to directly enter inside the blood vessel. They are very directly going to enter inside the blood vessel. But if I talk about the enteral route, there are different routes. Okay, I will take it through oral, sublingual, or rectal. It will go to the digestive system, or it will go to the systems. Then afterwards, it will go for the first pass metabolism. See, I know you might not be clear what is this metabolism. Now, don't worry. In further upcoming videos, I will explain you. There is very important concept which is first pass metabolism, which plays a very important role in understanding the drug activity or drug action. Okay, so they will undergo. For example, now just imagine here in airport when you go, right, there are two things. Okay, one is your premium route. Premium route means directly you can go and sit in the flight. If you are business class, if you are a rich person, directly you can enter inside the flight, right? Nobody will do anything to you. But if you are a local person like me, then what will happen? You will go to the railway, you will go to the airport, then checking is going to happen, then your baggage is going to get checked, then you get the boarding pass, like different steps are there, right? So they are going to follow this. Your enteral route of system are going to follow various steps, and then they are going to come inside the blood vessel. But whereas your parenteral route is there, they will directly go and sit inside the blood vessel to show the action. So it's very simple. Now can you tell me which drug, which type of route will give you faster activity? Those drugs which are able to reach the blood vessel as soon as possible are the drugs which are going to give you faster activity, especially that is your parenteral route. So if we talk about parenteral route of administration, whenever you are giving a drug in the parenteral route, this drug is going to show faster activity. The onset of action is going to be comparatively fast compared to your enteral. Because enteral route means just go to checking and various things are there. Let's give you an analogy. Okay, don't write an exam about checking an airport. I just gave you about the analogy. Okay, try to understand the analogy and then try to understand. And see, obviously, you will understand this by your first pass metabolism that we will be taking in the next video. Okay, so this enteral route will be having different, absorption has to happen, then distribution will happen, then metabolism will happen, right? Various steps will be happening, and then it will be entering inside the blood vessel. I hope it is clear. Now, in enteral route, there are again three things are there. Either you can give it to oral administration, then you can give it for sublingual, and you can give it for rectal. Okay, see, in different books, difference can be there. Okay, I am again telling you this content, difference can be there. Okay, there are again don't any comment section, sir. I don't know, like majority of the things are not, which are there, it's not there. Don't tell like that, okay? Because in various books, different ways there. So this is what I have decided. This is what I have taken into consideration. Okay, with respect to your examination. So mainly you are having oral, sublingual, and rectal. Okay, so if we talk about oral route of administration, very simple, very genuine. Okay, and nothing but you take the drug. You drink water, you swallow it, it goes inside your digestive system, and various activities are going to happen, and it should be drug action. Then if we talk about sublingual, what is happening in sublingual? What does sublingual mean? In anatomy, you might have heard what is lingua meaning, right? Lingua means tongue. Okay, sublingual means below the tongue. So those drugs which are going to be administered, or we are going to keep it below the tongue, it is going to have some activity. Okay, so why are we doing that? Why are we giving sublingual? Because sublingual also will pass, bypass your first pass metabolism. See, again you might be telling first pass metabolism 2 times you have to, that means it's a very important concept. Okay, we'll be discussing that. Again, I'm telling you, don't panic. In next class, we'll be discussing about your first pass metabolism. But just try to understand that if I ask you which route is better, oral route or sublingual route, then obviously the answer is going to be a sublingual route. Answer will be a sublingual route. Okay, but again, various advantages are there and again disadvantages also are there. We'll be discussing that in the upcoming time. Okay. Next is rectal. What is about rectal route? Mainly what are we having? We are having suppositories, right? So now you might be thinking, why do we use rectal? Okay. So what about the patients, especially kids, right? Small kids are there. You cannot give them oral, right? It's very difficult for them to swallow, right? So and for those patients who are having that, like who cannot swallow, those patients who are not swallow, or maybe who are unconscious. Like unconscious patients are there, like the small kids are there, they're like infants and all, they find difficulty in swallowing. Okay, so for those patients, you cannot give your oral or sublingual. That's why we propose we go for your rectal route of administration. Okay, so these are certain advantages. We are going for the rectal route of administration. The next one which we are going to have is parenteral route. Now I told you as I told you very simple. Parenteral means what? It is going to enter inside the blood vessel directly. Okay. So in that various forms are there: inhalation, injection, and transdermal. What is this? Inhalation, injection, and transdermal. Now inhalation means what? Certain anesthesias are there. General anesthesias are there. So when you inhale this anesthesia, right? It will go to the lung. It will go to the alveoli. In alveoli you are having a network of capillaries, right? So this network of capillaries, what is going to happen? The drug is going to be absorbed inside the capillary and then it will be passed on to the heart, and from the heart it goes to the different parts of the body. Okay? I don't know. I think you are all studied about pulmonary circulation and systemic circulation, right? So these drugs are going to be acting. Like these drugs are going to mainly if you talk about general anesthesia. Mainly if I talk about general anesthesia, this will come under the category of your parenteral route of administration. This will come under the category of your parenteral route of administration. Okay, next is your injections. So injections, right? Everybody is scared of, right? So we are having IV, IM, SC. What is SC? Subcutaneous. Okay, and IM is nothing but intra-arterial. Like inside the arteries you are going to give this. Okay, so mainly in thrombolytic therapy you are going to give intra-arterial injections. Okay, so I'm telling you. See, again I'll tell you general pharmacology. You will only understand after studying the whole pharmacology. Honestly, I will tell you according to my perspective. You will understand this chapter, general pharmacology, only, even for when I was studying for this particular examinations, right, I understood general pharmacology after studying the whole pharmacology. Before that, I didn't understand anything about general pharmacology. So don't panic, this is just an introductory lecture. You will understand, slowly try to develop some key points, remember that and then apply it. Or you can use it for your mistake, okay, fine. Then you are having your intramuscular, okay, directly in the muscles, the deltoid regions you are going to act, they are acting like a depot, okay, for sustained release, you are going to use this intramuscular. Then subcutaneous is there. Then intra-arterial is there, I told you in thrombolytic therapy. Then intra-articular, what do you mean by articular? Articular means between joint. Like in between joint you are going to have a synovial fluid. Yes or no? So directly we are injecting the drug inside that synovium cavity. Okay, that synovium cavity which is there. I hope you all know. Two joints which are there, that join together, and in between you are having a synovium cavity. Yes or no? So in the synovial cavity, which is the synovial fluid, when you are having especially rheumatoid arthritis, you are having, maybe spondylitis, you are having, right? In those cases, direct for showing direct action, we are using this intra-articular. We are using your intra-articular. Then intrathecal drug is there. Okay, intrathecal drug, like between the two thecus layer. Okay, we are going to give this delivery system. Then next is intradermal, like inside dermis. Like inside the dermis of the skin, we are going to give this particular injection, this particular drug. Okay. But now major problem, what is the major problem with injections? What is the major problem? Obviously it is not friendly, right? Is it friendly to you? No, it's obviously going to cause pain to you. So it's not, it's causing pain. One thing is patient doesn't like pain, right? It needs a quick therapy. The main thing is, it is causing pain. And other one which is important is that it can lead to certain infections. Because obviously, if you are giving you are giving steroid injection and everything, but still there are chances that at the site of injection, whenever you are at the site where you are getting the injection, right? So where the tissues are getting damaged, right? So when tissues are getting damaged, there are chances that infections can happen. So that's one of the major, this disadvantage. But then obviously, risk benefit ratio, we go for injection because you want faster action. Okay. Then next is it transdermal. In transdermal, you are having ionophoresis. Okay. Excuse me. So yeah, in transdermal you are having your ionophoresis. So what does transdermal mean? For example, let's try to understand very simple thing. Okay. So you are going to apply a drug on the skin. You are going to apply a drug on the skin. So transdermal means it has to get transferred from the dermis layer. Okay, just to transfer from the dermis layer. Okay, so one more. See, one is ionophorosis, other one is your adhesive patch. One is your adhesive patch. Okay, many of the people you have seen a white color patch, they will like painkiller, they will use it in the neck if they have a neck sprain, if they use it in an ankle, if there's an ankle sprain, elbow, if there's an elbow sprain. What are all these things? These are nothing but transdermal patches only. Okay, they will have a sustained release of the drug. They will have a sustained release of the drug inside the inside the particular muscle. But that one will come under the local action. Try to understand. Transdermal is coming in both. One is your parenteral route, other one is your local action. Don't get confused over here. When I tell you about local action, that means that painkiller patch. Okay, that means it's going to act. For example, my elbow muscle is paining. Okay, so if elbow muscle is paining, does the drug has to go to my GIT? Is it compulsory that drug has to go to GIT, or is it compulsory that drug has to go to the whole digestive system or your respiratory system? No, right? You want the local action. So what I will do? I will use this transdermal patches. So I only have this particular region where the pain is there the drug will get activated. There the drug will get. So what is happening? Instead of it going to the complete pathway, okay, absorption, distribution, or directly it is going to the where the pain is there, directly is going to go there. That's why they call it as a local action. Okay. Now, if I talk about your antidote, that means inside the blood vessel. Now it will directly enter inside the blood vessel. How does this transdermal help? In that you are going to have your, see, one more thing, this time, just make this change. Adhesive patches, no. Adhesive patches will write over here. Adhesive patches comes under here. Adhesive patches which is there. This comes under your local action. Okay. In transdermal, it only comes under ionophorosis. See, many are there. Okay. Something called induction is there. Jet injection is there. But in your particular syllabus, you have to understand about ionophorosis. So in ionophorosis, what is going to happen? You are going to apply the drug, and with the help of a strong, very small electric charges. Okay, with the help of a very small electric current, we are going to pass the ions. So drug molecule which is there, it can be either positive, it can be neutral, and we are going to pass the current. So when you pass the current, a very small amount of current, because of this charges, drug molecules will start to repel. These drug molecules which are there, it will start to repel, and this will increase the permeability. This will increase the permeability of the skin membranes without destroying the skin tissue. This is going to increase the permeability of the tissue, and with the help of as increased permeability is there, this drug with the help of charges, it can directly go and attack, or it can directly go and enter inside the blood vessel. I think it is clear. Just try to understand. We are applying the drug, we are passing a small amount of current, and with the help of current, the permeability of the skin membrane is going to be increased, and because there is more permeability, this drug can enter inside the blood vessel directly. This drug which is there can directly enter the blood vessel. That's why this is termed as the parenteral route. It is your transdermal. Is it clear? Then next is your local action. Local action means, as I told you, where the pain is there, where the application has to be there, directly that's the source of pain. Okay. One is your skin. Skin mainly if you are having any infections, any fungal infections you are having. So mainly instead of taking it, obviously you do take antifungal drugs are there. Okay. It comes in cream. Antibacterials are there. You can come in tablets also. But if it's going to show direct action, that will be under your topical agents. Now, for example, you are having cold and cough. Right? We are having cold and cough. So what will you use? You will use your intranasal drug. To reduce the inflammation in the nose. Okay? Reduce the inflammation of blockage of the nose. You have that. You have the drugs which are going to help in the improving your airflow. Okay? Going to improve. They are going to act as a nasal decongestant. Okay? Again, last topic. Your nasal decongestant topic is there. So that's nothing but intranasal. Okay? That's nothing but intranasal. And ocular drops are there. What are ocular drops? The one which are going to put in the eyes. Right? Ocular drops are nothing but those drops which are going to put in the eyes, like eye drops which are there for certain infections and all. But that again we will study that in detail. Okay? Then mucosal. So whatever drugs are going to act on the mucous membrane. Okay? That is your let it be vaginal mucus. Okay? Let it be your mouth, your buccal cavity is also having mucous membrane. Right? Then let it be your ear. So all these drugs, it will show local. For example, you are having some peptic ulcer or something. Okay? You are going to have peptic ulcer. So you might get some creams. You might get some gels which are going to apply on that surface. Yes or no? That will come under your mucosal chair. That will come under your mucosal route. Okay, it will show local action, but in the local action you have a mucosal route. Okay, now again you are going to have inhalation over here. Now inhalation over here means, for example, okay, see again you might get confused. Sir, inhalation you wrote over here also and wrote over here also. It's very simple over here. Here what happens in inhalation, for example, you are having asthma or COPD. Okay, when you are having asthma and COPD, so when you take this salbutamol and your the salbutamol is there, then your different drugs which are there, right? Like different classes of drugs which are going to use. So they are nothing but beta 2 agonists, right? They are nothing but your beta 2 agonists. So what are they going to do? What are they going to do? You are going to mainly, whenever they are taking a drug, they are going to act on the receptors which are present in the lungs. Now try to understand, are they entering your blood vessel? Are they entering your blood vessel? No, they are not entering your blood vessel. What are they going to do? They are mainly going to act on the receptors. They are mainly going to act on the receptors. Okay, I hope it is clear to you. Okay, so this is nothing but your local action. This is coming under your local action. And again, I told you about the transdermal patches. So what is this transdermal patches? Like the adhesive patches, which I just told you. That's nothing but you are going to apply it on the skin. So I hope the classification is clear. This classification is very important. Okay. Now in the upcoming video, what I will be discussing, I am discussing about the things which are important for your examination. That is your oral route, sublingual route, injection, and your intranasal route. Okay. I hope it is clear. So let's go and understand what are the advantages and disadvantages. Okay. I mean, while telling also I told you some advantages. Okay. So let's study the advantages and disadvantages of this particular classes of drugs in detail. Okay. Let's go ahead. So now we are coming up to a very important topic, okay? That is going to be about the different types of route and administration which are discussed in classification. Now, the same thing we are going to see the advantages and disadvantages. So as we are having different routes of administration, there are many advantages which is there associated with that and many disadvantages are there. So depending on the patient, okay, so depending on the patient, like how, like what is similar to us, like which is similar or which is more profitable or which is more easier for us, we are going to go for that route of administration, which will help us in giving of the desired therapeutic outcome. Okay. So now here, if we talk about mainly route of administration, we have divided into local and systemic route of administration. So local means what? Local is nothing but on the surface, in the sense that it's not going to enter inside the blood vessel. It's not going to enter inside the blood vessel. But whereas systemic circulation or systemic, if you talk about systemic route of administration, those drugs are the ones which are going to enter inside the blood circulation. So now let's try to understand about the local route of administration, like local route. So in the local route, first one which we are having is in the oral cavity. Okay, so how are we applying? Maybe whenever we get some infections, right? Maybe candidiasis we'll talk about, or any oral infection. So you are locally going to apply in the buccal cavity or the oral cavity. So one of the examples of such drug is your clotrimazole. So clotrimazole which is there, this is used for treating the oral candidiasis. This is used for treating the oral candidiasis, or you can say infections. You can say infections. So any buccal related infection which is there, we are using this particular drug. See, these are just the examples. Okay, these are just the examples. We will be going in detail about this different drugs and all whatever I am discussing over here. We will be going in detail about that in the upcoming classes. This is just the example to make you understand that how we are having the local action. Okay, fine. Now next is your GI tract. So what are the drugs which we use in GI tract which are going to show the local action? Okay. So in the gut, when you are going before the surgery, you have to use you have to clean the gut. Okay. So for sterilization of the gut before the surgery, okay, before we do the surgery, for the sterilization, we are using this drug, that is your neomycin. This is your pre-surgery. We are going to use this pre-surgery. We are going to use this pre-surgery for sterilization. For your sterilization. Then next is your rectum. So in the rectum, how are we having the local action? So mainly, nutraceuticals, like nutraceutics, pharmaceutics we have studied, right? We are using suppositories, right? So some suppository which is the common suppository which we are having, that is your bisacodyl. That is nothing but your bisacodyl. So what is the main function of bisacodyl? Bisacodyl which is there, it's a drug which is going to help in evacuation of the bowel. It is going to help in evacuation of the bowel. Okay, that is going to be that is the suppository which are going to give it through rectum, and that is going to have a local action. See, it's not going to enter the blood vessel. The drug which is there is not going to enter the blood vessel. It is just going to help in the evacuation of the bowel without entering the blood vessel. Now, next is your ear and eye drops. So those drugs which are going to put for example, whenever you are having any eye irritation, right? So that is because of any allergies. Okay, whenever you are having eye or ear infection or all this thing, it's mainly because of allergy. So we are giving an anti-allergy agent. Okay, that's nothing but your gentamicin. So see, again, there are many things which we'll be discussing, okay? These are just the certain examples which we are giving over here, which are going to have local action. So local action on the eyes and the ears, and ears and eyes, we are going to have your gentamicin. One example you can remember for each. I will request that you will remember one example for each. Then next is your bronchi. Bronchi, nothing but it's a part of lungs where alveoli are connected. Yes or no? So now in that, what are we doing? In your asthma, okay, whenever you are having any asthma or COPD, what is the main problem? You are feeling breathlessness. Okay, that's the symptom. But what is actually happening? The bronchi which is there, right, it is getting constricted because of various etiological factors, because of various reasons. Okay, your bronchi which is there, that's going to get contracted, that's going to get constricted. So for that, what we are doing, we are going to use a bronchodilator. For that, we are going to use bronchodilator, and one of the bronchodilator is your salbutamol. I hope it is clear here. Okay, one of the bronchodilator which is there, that's a salbutamol which will dilate the bronchi and help us in the breathing. Now, next one which is there we are going to use is your transdermal patches. Next one is your transdermal patches. So what are these transdermal patches? What is the main function of these transdermal patches? Like you before in the video I explained you, right? So whenever you are having any particular pain, right? So the particular drug should only go to the where the pain is there. Okay, it should give a rapid relief, right? Instead of you take a tablet, it will go and then it will get it will get absorbed by your intestine. It will take a lot of time, right, to show the action. So for rapid onset of action, okay, for rapid action, what do? We use this transdermal patches. Diclofenac. Diclofenac again comes under a painkiller. Diclofenac which is there, it's again going to come under your painkiller. That means it's going to reduce the inflammation of the muscle. That's going to help in reducing the inflammation of the muscle. I hope it is clear, okay? In local route of administration, let me see. In route of administration, we are classified into two. One is your systemic, other one is local. Local means what? Without entering the system, without entering the blood vessel. Whenever you are applying it, that is come under your local route of administration. Mainly your topical agents are there, okay? All these are topical agents, okay? Like we talk about oral cavity, you are going to apply in the buccal cavity, then you have GI tract, then you are going to have rectum, then ear and eye drops, bronchi, transdermal patches, all these which are there are coming under the local action. So now, the main thing you have to understand that okay, we are using these drugs, okay, like for various functions. So there are some advantages which are associated and there are disadvantages as well. So this again is a very important question, and you will get questions related to your advantages and disadvantages which are supposed to be very clear. Okay, so one of the advantage of your local action, local route of administration, is that you are going to have targeted action. So yes or no? So as we have seen, oral cavity, GI tract, we are targeting where we want the function or where we want the desired therapeutic outcome. There directly we are going to apply the drug. Okay? In this route of administration, what we are doing, where we want desired therapeutic outcome, directly we are going to apply the drug over there. For example, you want to evacuate the bowel, directly you are putting the suppository in the rectum. You want that your infection in the mouth should get cleared. So what you are doing, directly you are applying a gel, right? Directly you are going to apply a gel inside the mouth. Okay. So now the next advantage which is there over here, that is, it is going to have rapid onset of action. It is going to have rapid onset of action. Yes or no? So obviously, right? When it's not directly you are going to apply, no, so drug can directly go and enter inside the particular tissue and show the therapeutic outcome. It does not have to undergo any metabolism like see again. In the upcoming class, I will tell you about pharmacokinetics and pharmacodynamics. Okay, you might not understand this here. How does it show rapid onset? Okay, so for this I just give you an example. For example, you are having you maybe see I'm a football player. Okay, so I'm going for playing football. I fall. I got a sprain in my leg. Okay, so there are two things I can do. One is that I take a tablet, say diclofenac tablet I take. Okay, then other one is that I apply diclofenac patches. Which one will give me faster action? Yes, obviously the diclofenac patch, right? Because when I take it orally, it will take again. There's some time it needs to disintegrate. The tablet will disintegrate. It will go in the stomach. After it go to the intestine, it will get absorbed. So there are different processes are there, which will take time. Okay, the onset will not be there. But directly, if I am applying diclofenac to my muscles, directly the drug which is there is able to reach the muscle or the targeted action. Okay, so it is going to show targeted action. So because of targeted action, you are going to have a rapid onset of action. I hope this is clear here. Okay, so next advantage which is over here is that you need a lower drug dose. So what does it mean? For example, again the same story. Okay, I fell down. I had a diclofenac patch. I am taking diclofenac tablet. So the drug which is there, the amount of drug which is there in tablet, and if you compare the drug which is there in diclofenac, the drug which is there in diclofenac patch is going to be comparatively less. Okay, so drug which is going to be there in the patches is comparatively less. The concentration of the drug will be less, because if you are taking tablet, okay, you are taking a tablet in a very high quantity. The quantity of the drug which is there, or the concentration of the drug is there, okay, is going to be comparatively more, because it has to go through the various processes, right? Especially your ADME. That's nothing but your absorption, then your distribution has to happen, then your metabolism has to happen, excretion has to happen. So till it reaches, okay, till it reaches to your particular tissue, it will be decreased. The concentration will decrease. So initially you need, in the tablet you need a comparatively more dose. But now, because I am providing it with, we are having this, directly we are going to have it, directly we are going to have it in a diclofenac patch. So what we are doing, directly we are targeting into the tissues. So this is one of the advantages we are having, that the drug concentration or the amount of drug is comparatively less doses required. Now, the fourth one which is there, which is required for you, is that this is going to have improved efficacy. These local actions, okay, disadvantages, the local actions which are there, they are going to have improved efficacy. Now, what do you mean by efficacy? Efficacy means it's more efficient. Okay, the drug dose which are giving for getting the particular therapeutic activity is going to be more efficient. Then next one which is there is that it is going to reduce the drug interaction. Very important point over here. I'm going to tell it. You don't understand the importance now, but this is very important, that it is going to help in reducing the drug interactions. Because we are going to apply it to tissues, right? So it does not, for example, you're taking a particular tablet before, right? So I'm not sure if you've been knowing what is drug interaction. I'll just tell you short. So when you're taking two drugs, right, together, some drugs are there which they interact with each other. So either they can, nullify the effect of each other. Okay, again you learn that. Okay, further videos you learn antagonism, synergism. Okay, different interactions are there. So it might improve the efficacy or it might decrease the efficacy. So many things are there, many factors which are there which can be responsible. But here you have to understand that if you are using this local action, it is going to reduce the chance of this drug interaction. Because see, where does the drug interaction happen? In the blood. But are we entering this in the local action? Is the drug entering inside the blood? Is the drug going to enter inside any system? No, right? So obviously this is going to reduce the drug interaction. Okay, so I hope the advantages are clear. I hope the advantages which are there, they are clear to you guys. Now, next is the disadvantage. So what is the disadvantage? I mean, okay, maybe you will have fell down sometime, right? Like you are applying, you have applied some gels, right? So what is the main advantages? Main disadvantage you will have this. What is the main disadvantage you will have? That it can cause irritation, right? It's the potential of, it can potentially cause irritation. These drugs which are there, I mean, when you are giving it local action, okay, when you are giving eye drops, right? I mean, whenever you are giving eye drops and you are closing it, right, it might cause irritation to some patients. So, I mean, this is not like, see, again, we tell that, different advantages and disadvantages are there based on the patient. Okay, based on the patient, we are going to choose the best suitable route for that particular patient. Okay. But the main thing is that it is potentially going to cause irritation. Now, the next one which is there is that it is going to have a high risk of contamination. It is going to have high risk of contamination. It is going to have high risk of contamination. Okay, because see, again, it's exposed, right? That gel which is there or whatever you are going to apply it on the skin, it's going to be exposed to the environment. So the contamination chances are comparatively more in case of your local action. Now, the third one which is there, that it is going to have short duration of action. It is going to have short duration of action. Now try to understand over here. Onset of rapid, it's going to have rapid onset, but the duration, for example, if I'm taking diclofenac tablet, I'm taking diclofenac patch. The diclofenac patch might provide me a relief for approximately 2 to 3 hours. Diclofenac patch which I'm applying, that might give me a relief around like 2 to 3 hours. But if I'm taking a tablet, that will provide me relief for 6 hours. That is the difference. Okay, so if you want quick relief, do you over patches? But if you want for a longer duration, then you will use some different route of administration. So again, depending on what the patient wants, or depending on what the desired therapeutic outcome you are expecting, we will choose the route of administration. So I hope it is clear to here. Now, the next one which is over here, you have to understand that you are having limited scope in your what you talk about in your these drugs are local administration are going to have limited scope. So what do you mean by limited scope? What do you mean by limited scope over here? Limited scope means the thing is that you cannot make all the drugs in this way. Okay, the limited scope in the sense there is not much drugs which are there. Like when you want a particular action, not all drugs are can be formulated in the way of this local route of administrations. Okay, for example, certain tablets are there. Okay, certain drugs are there. They cannot be converted or they are not soluble in water. Okay, not soluble in water. So obviously, they're not soluble. If they're very having a very low solubility in any of the solvent, now what we can do? We are not able to make a particular suspension properly. We are not able to make a particular liquid. any dosage form we are not able to make. Okay, so for that we have to use again different route of administration. So route of administration not only depends. Okay, not only depends on the patient, but you also have to see about the quality of. about the type of drug. Which type of drug you are going to use. Based on that, it is going to differ. So I hope it is clear for the local route of administration. You have to know the advantages and disadvantages, and this will be your important point. So now, okay, fine. Let's go for the next one. So now, after finishing the local route of administration, now we'll be entering inside the systemic route of administration. Okay. So in systemic, see, main thing I told you, right? In systemic route of administration means the drug has to enter the blood vessel. The drug has to enter the blood vessel. So by that also there are two methods. One is your enteral system, that is the enteral route of administration. Other one is para-enteral route of administration. So the understanding of this enteral and para-enteral plays a very important role. Okay. So the enteral route of administration which is there, that means that when you're going to take the drug, okay, through any of the GI system, for example your mouth, right? So what is that GI system? Gastrointestinal system. That means which includes your buccal cavity, it includes your esophagus, it includes your stomach, it includes your intestines, it includes your rectum, right? So whenever you're taking any drug or when you're administering the drug into the GI system, okay, whenever you're administering the drug through the GI system, that will come under your enteral route. Okay, in that you are having, if you are doing it, if you are taking a drug through oral, then it will come under oral route of administration. Then other one is the sublingual route of administration. Then next is your rectal route of administration. So these three are coming under your enteral route of administration. Let us go for the advantages and disadvantages for these three. Now, for the exam point of view, this sublingual route of administration is a very important question. I think even in last year paper also, this was a very important question. For 2 marker it had come, and every year usually they will ask you about the advantages and disadvantages. Okay, so in your question bank also one very important question is there about the advantages. State the advantages and disadvantages of the sublingual route of administration. We'll discuss about it. Okay, so let's go for first the oral route of administration. Simplest way, very easy to understand. Oral route of administration means nothing but your tablets, syrups, and all this thing, right? Taking it through buccal, taking it through oral cavity. Okay. So what are the advantages of such drugs? So mainly the advantages over here is that they are painless. They don't cause you any harm. For example, if you go for injections and all, pain is there. But what about this? In oral route of administration, there is no discomfort. There is no, it's a painless thing. And do we need any doctor to come and give you the drug over there? No, you can easily self-administer that. So that is one more advantage which hits in the oral route of administration. Then it is going to be cheap. Now I'll tell you how does this cheap and cost affect. Who decides what is cheap and what is cost? Okay. So see, tablets which are there, tablets are not going to, they're not directly going to enter inside the blood vessel. It will be traveling through your gastric mucosa, it will be traveling and getting absorbed, right? But whereas with IV are there, injections are there, they're directly going to get injected into your blood vessel. So if we talk about the quality control, where the quality control will be more stringent or where the quality control will be more far, it will be in the IV production or it will be in tablet production. Yes, it is the IV production. So because there is more quality control over there, more safety measures are taken in your IV because it should be sterile. In IV solution it should be sterile. But tablet, even if there is here and there, some here and there if it's there also, then also it won't create much effect to our body because you take it, you go to digestive system, you're having some enzymes and all, so they will be all, what do you say? They will be killing all the microorganisms, even if it's there. So sterility which is there, yeah, it does play a role, but not as much as in IV. So more sterility, more QC, more quality control and assurance will be there. So that's why the cost of the injections will be comparatively high and the cost of the tablets will be comparatively less. This is what is come under here, cheap. That's why I call oral. See, not all oral tablets are cheap, but yeah, generally you can say that yes, it is going to be the cheap ones. Now, let's go for the disadvantages. What are the major disadvantages of this particular oral route of administration? There are certain drugs which are going to be highly irritating. Okay, so you cannot take it through buccal cavity. Some drugs which are there, the highly irritant drugs which are there, they cannot be taken or they are not suitable to take in the oral route. Then what about the drugs? Some drugs are there which are not palatable. What do you mean by palatability? Again, this also we have to fix. What do you mean by palatability? That means you should be able to accept the drug. Okay, if the drug is too bitter in taste, okay, the drug is too bitter in taste and you're not able to convert it to a desired formulation, then what will happen? You won't be able to take that particular drug, right? So some drugs are there like that which are highly irritant and are not suitable for oral route of administration. Then other one is that those drugs, there are certain drugs which will not get absorbed. Now okay, you're taking a tablet, okay, it will go to your stomach, it will go to your intestines, but when the process of absorption comes, that's the first process, right? The drug has to get absorbed. But imagine if the drug is your lipids, or if you talk about your lipid drugs, or if you talk about your unabsorbable drugs, you cannot give it through the oral route of administration. An example of such drug is nothing but your aminoglycoside. It comes under antibiotics. It comes under antibiotics, which is insoluble. You cannot take in the oral route of administration. And the next one is that certain drugs are there, okay, this is a very famous one. Certain drugs are there which will be destroyed by the digestive enzymes. Okay, so like you have pepsin, you're having HCl, right? So these acids which are there, or this these enzymes which are there, they will destroy the drug. So before it shows an action, like absorbing into action, it will be destroyed by the digestive enzyme. So those drugs which are susceptible for the destruction, so the gastric secretions, they cannot be given with the help of the oral route of administration. Such example, very famous, that is insulin. You will have thought, right, why insulin patients, I mean why the diabetes patients have to always take the injections or the, like the needles and like that to do this thing, why intravenous or why it is given in the form of parenterals? Because obviously if you are taking insulin tablets, this insulin will be getting digested. This insulin which is there, if you talk, it will be the digestive enzymes which are there, they will be attacking this insulin and destroy the insulin. So if there is no insulin, it won't get absorbed to the blood vessel, and if it doesn't get absorbed, then the desired therapeutic outcome will not be seen in this case. So that's why you have to understand that the drugs which are destroyed by digestive juices cannot be given in the oral route of administration. Let's go for next one. Next one is just sublingual tablet. As I told you, again and again I am repeating, it's a very important concept, very important question you will be having in the examination. What is sublingual? You will have studied, I told you before session also, lingua means tongue. Below the tongue, those drugs which are going to keep below the tongue. Okay, so those terms will come, those route of administration will come under your sublingual route of administration. So now, what are the advantages of sublingual route of administration? The very important advantage is that it is going to bypass the first pass metabolism. Now, what is first pass metabolism? You will understand in my next video about the pharmacokinetics and pharmacodynamics. So just wait, have some patience regarding the first pass metabolism. What is first pass metabolism? Okay, but this is very important. This plays a very important role. Then other one is that sublingual. So whatever the vessels are there, blood vessels are there, right? It will be directly absorbed. Okay, you will keep in the buccal cavity and you will keep in the sublingual below the tongue. Whatever the blood vessels are there, okay, below tongue is very highly vascularized area. So whatever blood vessels are there, they will be absorbing the drug. That's why you will have quick onset. Because so see, because it is able to bypass the first pass metabolism, you are going to have a quick onset. Okay. Now, one more very simple, very peculiar characteristics of sublingual route of administration is that drug action can be terminated by spitting. So for example, what does this mean? You are taking the drug, you are having an action. So if you want to terminate or you want to stop the drug action, you do not do anything. Just simply spit out the drugs. If you spit out the drug, what will happen? The drug won't get absorbed. So the action will not be seen. So it is very easy to terminate the dose, or is it very easy to terminate the drug action? Okay, I hope it is clear to you. Okay, and please understand this is a very important question you will be getting in exam. Now, what are the disadvantages of certain drugs? What are some disadvantages of sublingual drug? Whatever drugs are there which are having bad taste, okay, they cannot be taken sublingual. Will you take anything bad taste and keep in your mouth, blow tongue? Obviously not, right? So that some drugs are there you cannot give, okay, you cannot give it through the sublingual route of administration, especially those drugs which are non-palatable. You cannot accept it, okay, which will be having better taste. You cannot take that kind of drug. Okay, then other thing which is there, lipid and insoluble drug. Okay, lipid drugs means like they won't be soluble, right? They are insoluble drugs. So again, you are keeping in the buccal cavity, but because they are insoluble, it cannot be absorbed. It cannot be absorbed. So these drugs cannot be given in the form of your sublingual route of administration. And even the irritant drugs also cannot be given. So what is it? Lipid, insoluble and irritant drugs. So obviously, if something is causing irritation in your mouth, will you keep it inside the mouth? No, right? So these type of drugs which are there, which are irritation, which will cause irritation to the buccal cavity, will not be given to the sublingual route of administration. I hope it is clear. Okay. Next one which you are going to go is to the rectal route of administration. Now you might be confused that sir, even in the local action we told rectal, even systemic action during rectal. Yes, because the rectal route of administration which is there is having both local and systemic action. Okay, please take note this, that it is going to have both local and systemic action. So, what is the major advantage? Okay, there we told, right? What is the, when we discussed about the local route, I told you that the glucose which is there is going to help with evacuation of the bowel. Okay, that's a local action. That's not going to enhance the blood vessel. But now, there are certain drugs. There are certain conditions in which we have to give rectal route of administration. For example, infants which are there, it's very difficult for them to swallow any particular tablet, right? Even liquid also, if they're taking it, they'll burp it out or they'll remove it from the buccal. So they won't get desired therapeutic outcome. So what we will do, we have another option, that is the suppository, or we can give this suppositories to the infants, okay, who are facing difficulty in swallowing, especially like small, very small, around like 6 to 12 months, we can give this kind of drugs to them. And next one is your unconscious patient. So unconscious patient, you cannot give anything through oral mouth, right? You won't have any action. So for those patients, we can give this rectal route of administration. So I hope the advantages, the application of the rectal route of administration is clear to you guys. Now, next one, what is the disadvantage? So obviously, right? It is a social stigma. Not everybody, not everybody is comfortable. They have discomfort with the rectal route of administration. Okay, and even there is a social stigma in the hospitals, right? So nobody will obviously take a route of administration. Instead, they prefer you give me an injection or you give me a tablet. But nobody will go for the rectal because it's a social stigma. Okay, so yeah, again I told you, based on the disadvantages and advantages, we can decide which route of administration is better for giving the therapeutic outcome. Now, next we will be discussing about, now we discussed about local, we discussed about local, we discussed systemic. In systemic, we studied about the enteral route, okay, that means the intestine, through the GI tract, whatever drug we can administer. Now let's go for the parenteral. Let us understand what is parenteral route of administration. So now let's start to discuss about your parenteral route of administration, okay. So as we told the main difference, okay, parenteral and enteral. Enteral means whenever you are administering the drug through the GI system, okay, it will be your oral or your sublingual or your rectal, all these will come under your enteral route of administration. Other than the GI, okay, whatever other routes are there, right, the remaining routes, they will come under your parenteral. That's the name comes here, parenteral, except the enteral route of administration. Whatever routes of administration are there, they are coming under your parenteral route of administration. Now, one more difference I told you in the initial classes, the difference between enteral and parenteral. Parenteral means those drugs which are directly going to enter the blood vessel. Okay, these drugs which are there, they are directly going to be exposed to the blood vessel. So let's try it out and try to understand the different types of your parenteral route of administration. For your examination, you have to remember that there are 3 types of parenteral route of administration. One is your inhalation, other one is your injection, one more is there is your transdermal route. Okay, I have told you that. So it is going to show your local effect also and systemic effect also. We'll be discussing it after your injection. We'll be discussing about the transdermal route of administration too. Okay, let's start about the inhalation route of administration. So what is happening in the inhalation route of administration? What are the major advantages you are going to have? The major advantages is that you are going to have a quick onset. So main thing we have been discussing it in systemic route of administration we are discussing, especially your parenteral route. Okay, if you compare your enteral route and parenteral route, the quick onset of action is seen in the case of your parenteral route. It will be your injection, it will be your inhalation, it will be your transdermal. The quick onset of action is given by your parenteral route compared to the enteral route of administration. Okay, I hope that is clear. Now, next over here is that the dose which is required is comparatively going to be less. See, in the initial also I told you, right? Try to understand the relationship between the amount of dose required and the route of administration. Okay, if the drug is directly going to go inside the blood vessel, the concentration or the amount of drug is comparatively less required. Okay, it's less required. The drug which is there is less required. But whereas when you are going to give it through your oral route or your rectal route, it has to pass through the various pharmacokinetics and pharmacodynamic interactions. So the concentration of drug which are given in the enteral route of system has to be more. So that is very important to understand the relationship between the amount of drug and the route of administration. Okay, fine. Now here, as I told you, dose is going to be less. So because dose is less, the systemic toxicity. So see, One thing you have to understand that when you're taking a drug over there, when they're going to take a drug inside your body, there are two things which are going to happen, okay? One is the desired therapeutic outcome, other one is the undesired therapeutic outcome. The undesired therapeutic outcome is nothing but you call this the side effects. So, the dose drug, if you're giving the less dose over here, the drug toxicity or the systemic toxicity, we can reduce it by using this type of your route of administration. Now next is the amount of drug can be easily regulated. Now inhalation, especially this is very concerned with the inhalation. Whenever you are giving any drug of inhalation, we can easily control the amount of drug. But for example, tablets can be controlled. No, right? For example, you are giving around 2 grams of a tablet or 500 mg of a tablet. Can you control? Once it enters the body, that's it. You cannot control it. Can you reduce it? Can you increase it? No. I mean, increase means obviously you can give extra tablet. But can you reduce the tablet? No, right? But in this type of inhalation, in this type of administration, you can control the amount of drug which has been administered. I hope it is clear to here. Now, the main disadvantages because of inhaling, right? So there are some, some irritant drug molecules are there, some irritant drugs are there. They can cause your local irritation. And because of local irritation, it can increase the respiratory secretion, the mucus secretion which is there, and it causes the bronchospasm. What is bronchospasm? Bronchospasm is nothing but constriction. It is nothing but the constriction of the bronchi. It is nothing but the constriction of the bronchi. I hope it is clear, okay? It is going to cause local irritation, so it will cause increased respiratory secretion, which will lead to the bronchospasm. That means rapid constriction, okay? Rapid and sudden constriction of the bronchi is called as your bronchospasm. You will have heard, right? Spasm. What does spasm mean? Okay? So these are the important points about your inhalation, about the inhalation route of administration. Now, next one under parameter which is there, that is the injection. So, see, this might confuse you, okay? Let's go for a simple thing and try to understand the main mechanism. If you know the mechanism, it will be easy for you to understand the whole phenomena, okay? See, now, this is the outermost layer of the skin, okay? That is the epidermal layer. So, between the dermal layers, the injection which is going to be given between the dermal layer, that we are calling it as intradermal. That is, we are calling it as intradermal injections. We are going to administer between the dermal layer of the tissue. Next is your subcutaneous. So I think you all are studying in your HAP, right? You're having the layers of the tissue, layers of the skin. You're having skin, then you're having the subcutaneous fatty tissues. Then you're going to have certain difference of the rest, strata cornea, all this thing is there, right? And last one, what is there? You're going to have the muscles. Yes or no? So now here, when you are going to give the injection, when the site of injection is going to be in the subcutaneous region, then we call this as the subcutaneous route of administration. I hope it is clear. Now, again, after the subcutaneous tissue, what is there over here? Then you are going to have the various blood vessels. These are nothing but the blood vessels. These are various blood vessels which are going to be there. So then there again two are there. If you are injecting the drug inside the artery, if you are injecting the drug inside the artery, that's called as your intra-arterial route of administration. And if you are giving it through veins, okay, if you are giving the route of through the veins, that is your IV mode. That is your IV mode of your interaction, and then IV mode of route of administration. Now, next is your intrathecal, okay? What is intrathecal route of administration? Intrathecal route of administration means between the two thecal layers you are going to give, okay? Between the two thecal layers, you are going to give this. So, mainly this is given for the spinal, okay? Spinal, you are going to have the thecal layers, right? So, between the spinal, the subarachnoid space which is there, we are going to give this intrathecal type of administration, intrathecal route of administration. Now, one very important route of administration we have to understand is this route. When you are directly going to inject, when you are going to directly inject the drug into the cavity, the synovium cavity, okay? This, especially in the case of, when there's a huge, there's too much inflammation in the joints, especially in the case of spondylitis you talk about, the rheumatoid arthritis you talk about, there's an inflammation in the joint, okay? So we are going to directly inject the drug into the particular space, in the synovial cavity, okay? That one is called as your IA. What is IA? Intra-articular injections. Okay, intra-articular injections. We are directly going to give the dose inside the articular joint. Okay, I hope it is clear. This rule of administration should be clear. If this diagram is clear, automatically you will be able to understand the different things which are over here. Okay, fine. Now, next we talked about the intradermal. Now, why are we using this intradermal? We are mainly using it for vaccination testing, right? Tuberculosis we talk about, and tubercular BCG vaccine which is there, right? And particulars, checking the sensitivity of the drugs, like penicillin sensitivity, you are going to check the drugs, right? So for those drugs, when you are going to check the sensitivity, that is going to be nothing but your intradermal route of administration. But now I think majority of you have done, no? Mainly when you are in the, especially checking for the TB or when checking for the different drugs. sensitivity, many of the people have faced this route of administration is going to cause comparatively lot of pain. This is going to cause comparatively lot of pain. That's the main problem with this drug. Okay, intradermal route of administration is going to cause a lot of pain. But now let's talk about the next one. That is subcutaneous tissue. It's very easy, and the thing over here is this can be self-administered. This drug is usually given in the, it can be easily taken by yourself. It's self-administered into the subcutaneous tissues. Okay, into the subcutaneous tissue. So where mainly which type of drugs you are going to give like that? They are mainly your insulin drugs. Like you are going to have the insulin pens, right? You just give a click. It's very self-administered. You don't need any assistance over here. But whereas other route of administrations, you need an expertise person who can help you out with the route of administration. Then next over here, adrenaline and non-adrenaline. Okay, even your adrenaline and the non-adrenaline can also be given through this route of administration. Now, next problem with this drug is that the irritant drugs, cannot be given through this route of administration. It can cause irritation in the subcutaneous region, so you cannot give it. Okay, and the drugs which are absorbed, the drug absorption which is there now, is going to happen comparatively slow. So the thing is, whenever there is a medical emergency, you cannot go for subcutaneous route of administration. Whenever there is a medical emergency, you cannot go for the subcutaneous mode of your route of administration. The next one is your intramuscular. What is an intramuscular route of administration? That means directly we are going to apply the drug. Directly the drug is going to be administered inside the muscle. Now these mainly muscles like gluteus maximus, that is the buttocks region or maybe thigh regions is what we are going to inject it. So when are we using this? Very famous, right? Whenever you get fever. Right? Whenever you get fever, you go to a doctor and doctor is going to give you injection, right? So that is mainly for that, it's a painkiller. Painkiller you can say, antipyretic you can say, and reducing the fever. These type of drugs which are there, they are mainly given in the form of your iron. Sorry, they are mainly given in the form of your iron. That is your large muscles, that is your painkillers. I hope it is clear to you guys. And this absorb very rapidly. Okay, these are very absorbed rapidly. That's why you get, you go for a drug. Immediately when you take an injection, you get relief, right? But similarly, if you take tablet, it will take some 6 hours, 7 hours for you to get relief. But if you take an injection, just after half an hour, you are all fine. No fever, no pain, right? You will have observed it. So I hope you know that. Okay. Now the next one is going to be IV. What is IV? These are intravenous route, like directly in the veins you are going to add. Okay. The main advantage of this drug is that large amount of volume. See, in this other routes of administration, large volume cannot be taken. The large amount of fluids which are there, or large amount of drug which is there, cannot be administered. But in your intravenous route of administration, please try to understand. In your intravenous route of administration, large amount of drug or large amount of fluid can be given. So especially in the case of your severe dehydration, right? Especially in the case of your like diarrhea patients and all, they take salines, right? So large amount of volume which is there can be transferred with the help of this route of administration. The one very major advantage is that the bioavailability of this particular drug, or when you are applying, when the drug is given through intravenous route, the major advantage is that the bioavailability is going to be 100%. Is going to be 100%. That means whatever drug you are giving, the same amount of drug is going to reach to the site of the site of the action. Okay. The next one is your intrathecal route of administration. This intrathecal route of administration which is there, we are mainly giving it for the spinal anesthesia. We are mainly giving it for the spinal anesthesia. We are going to inject it in the subalpinate space of the spine. We are going to inject it in the subalpinate space of the spine. And this is mainly, now problem with this drug, subalpinate space we are injecting, right? There is a high potential that even if we are giving a slightly higher dose, okay, when you are giving this a slightly higher dose, it can lead to the high risk. It can show ADRs because it is very potential. It is very potential to your overdosing of a drug. It is very potential to your overdosing of the drug. So I hope it is clear to you guys that different routes of administration. See, again I am telling you, these are the very important things. Okay, these you will get the questions for your examination, especially if you talk about different types of injections you are supposed to know. And in fact, if they ask you advantages and disadvantages of your parenteral route of administration, you can combine and write. You can combine and write about the, because see, we discussed many advantages, we discussed, here also we discussed majority of the advantages and disadvantages. We have to combine and write for the parenteral route of administration if they ask about the advantages or disadvantages. Okay, here one very important thing is that IM question can come. Intramuscular advantages, disadvantages can come, and a subcutaneous advantages, disadvantages can come, and this is mainly there in your B.Pharm papers. This is mainly there in the B.Pharm papers. Okay, so now next time which you are going to study, the last route of administration which is there, that is the transdermal route of administration. So what is transdermal route of administration? Can anyone tell what will be the transdermal route of administration? We already discussed this. The main concept which comes under this transdermal route of administration, that is your ionotophoresis. If we talk about the third one that is there, that is the transdermal route of administration. That is the transdermal route of administration. In the transdermal route of administration which we have learned, we are mainly going to learn about the ionotophoresis. What is ionotophoresis? In the ionotophoresis, we are going to deliver the drug. Okay, it's a type of delivery system of a drug. We are going to deliver the drug with the help of ions. Okay, we are going with the help of the mild electric current. With the help of a mild electric current. Okay, so now the main advantage of this, drug is that it is a non-invasive. You don't have to inject anything. Okay, directly it is going to enter the blood vessel. Okay, it will increase the skin permeability without causing any pain, without causing any invasiveness. This is going to help us in delivering the drug. But what is the disadvantage of this drug over here? These drugs which are there, which are giving it through electric current, right? Those drugs which are not into ion form. Okay, those drugs which cannot be converted into ions. Those drugs which cannot be converted into ions, they cannot be given to this mode of your route of administration. Okay, so those drug molecules which cannot be converted into ions, they cannot be given. Now, one more thing is that because of the sweat, we apply on the skin, right? So because of the sweat, major disadvantages. Because the sweat which is there, this transdermal patch which is there, okay, the adhesiveness which is there, it might decrease. Okay, so what will happen? Because of sweat, it will start to peel off. Because of sweat, it will start to peel off over here. So that is one of the technology to remember. What is ionotophoresis? What are the advantages and what are the disadvantages? So major disadvantage over here is that the drugs which are going to have, which cannot be converted in the form of ions, they cannot be delivered in this route of administration. But whereas, what is the main advantage over here? It's a non-invasive process. And one very important I forgot over here, just try to note it, that this is going to have this mode of nutrition. You will have sustained release of the drug. Now, what is sustained release and controlled release? We will be discussing in the later class. But to remember that this is going to have a sustained release. Sustained release is there over here. Okay, sustained release is there over here. And now see again here also the absorption is there, it's comparatively slow. So you cannot use this for the emergency purpose. Okay, and even a current also, the mild current also. So mild current is there, it might cause burn also. It might cause burn. Okay, so these drugs which are there cannot be given in the form of emergency. In a medical emergency, we don't usually prefer this kind of drugs. So I hope all the routes of administration is clear to you guys. Okay, so maybe after uploading this video, okay, we'll be sending you the notes also in the stick. It will be easier format. Okay, so main thing what I want to do is please make a separate note. Okay, whatever you are having lecture classes of this thing, please maintain the notes and see. After every question which is there in the comment section or in the message box, we will be writing the important questions, and we want you guys to write a separate book where you can write all the important questions, all the question bank answers, and we will also provide you the thing. Okay, either you can take a print. If you are lazy like me, you can take a print. But if you are active like my friends, then obviously you can go and start writing for the answers, because if you write the answers, you will learn how to write in the exam. You take a print, you will remember, but when you are going for exam, you won't be able to write the answers. So for writing practice is very important. So better, whatever questions are there in your question bank, start task to solve. Okay, so this is for today's video. We will be coming up further with the pharmacodynamics and pharmacokinetics. Hope you like it. Please like, subscribe and comment whatever doubts are there. We will respond to you guys. Thank you guys. Have a great day.